Hey everybody, I just wanted to go over the bariatric journey pre-op. I just wanted to give everyone kind of like a guideline of what to expect, or if you don't even know how to start the journey, how I started it. I also work at health insurance, so hopefully I'm able to explain it better as well. So for me, when I decided to have bariatric journey, the surgery, I have a bunch of coworkers that had already gone through it, and I never even heard of it before I even started my job. So back in 2017, I thought about it, and then I was scared, and I was like, oh, I can't do it. That sounds major, all the changes, you know, all those what ifs. So then when I seriously decided, no, I'm doing it, that's it, I can't do this by myself, I need this help also, was before my 30th birthday. So last year in April 2019. So my birthday's in May, so I was about to turn 30, and I was like, I can't be this big. I'm tired of being this big. So the first thing you need to do is you want to either call your insurance company or go online to your insurance company, and you want to do a provider search. You want to look for a surgeon or a provider name or facility for bariatric surgery. So sometimes you could search Google first and then find doctors based off reviews, if you like to look at reviews and see bedside manner and all that and everyone else's experience, and then choose that doctor's name and then put it in your insurance provider search and see if they're actually in network. It's very important to make sure they're in network, because the benefits, you want it paid as much as possible through your insurance so that you're not paying out of pocket. But it also depends on what your coverage is for your insurance. So yeah, so once you find the doctor or provider facility that you're gonna choose, then at that point you want to go to their website or call them. If you call them, you want to ask them, I'm interested in getting bariatric surgery, how do I start? And most likely they're going to refer you to, you have to do an in-person seminar. Now, I researched 3 different bariatric facilities with doctors before I decided on one, and I went to 2 different seminars for the 2 different doctors as well. So for that, it was, you had to go to an in-person seminar only for 2 of them, and the 3rd one was in person, or if you couldn't do in person, you could do an online seminar, but at the very end was a quiz as well. So I would say do the seminar. It's not gonna hurt. Do the seminar, because once you have the seminar, and if you do decide, you say, yeah, I already did the seminar, so then they can actually book you for your appointment. They won't book you for an appointment until you've done the seminar. So I didn't do my seminar until it was April 17th. It was on a Wednesday, I believe. But yeah, so during the seminar, it's either the doctor or the nurse will tell you everything about bariatric surgery. They'll tell you the different surgeries, they'll talk about the bypass, they'll talk about the sleeve, and they'll still talk about the, why can't I think of it right now? The 3rd one, I'll insert it on the screen, I can't think of it for some reason. So they'll talk about the different, in the band, there you go, in the band. So they'll talk about the 3 different surgeries and what the different surgeries have to offer. I mean, they're all gonna help you lose weight. They don't, for the seminars I went to, the band surgery, they said they just didn't recommend it anymore. So they talk about that, and then they talk about your recovery time and going back to work, and then life after bariatric surgery. Also, if you have health issues, what health issues it will resolve, and what will qualify you by insurance to get covered for the surgery, like morbidly obese over 40 BMI, I think it is. And then like if you have hypertension or diabetes, those are some diseases, if maybe you're under the BMI, that you can still get approved for the surgery. So either in combination, or if you have one, then maybe you don't have to be as obese. So you do the seminar, they're gonna give you a packet as well with all the information they went over. And then at that point, they tell you after the seminar, when you're ready, call the office to make your appointment. I advise do this immediately, because you'll be surprised how many people are taking this journey. Like, I never even knew about the surgery before, there's a lot of people taking the journey. So when I called immediately the next day after my seminar, I didn't get an appointment until May 3rd. So I had to wait like almost 3 weeks before I can even get my initial consultation, they call it. So yeah, so when you do your initial consultation, you meet with the surgeon, the actual surgeon you picked, and they'll sit down and they'll discuss what surgery you're interested in. They go over all your medical history and then also the surgery that they recommend as well. And then at the end of my consultation, the nurse gave us a sheet of it's a long sheet, of all the things, a checklist of things that you have to do to get approved by your insurance. I recommend highly, before going into this appointment, call the number on the back of your insurance card and ask for benefits. Get the full benefit so you know before going there, because what happens is, like for example, I work a federal job, so my insurance is a carve-out plan of Aetna. So they automatically saw Aetna and gave me the basic benefits for Aetna. But for example, I didn't have to do 4 to 6 months weigh-ins, the nutrition counseling. I only had to do 3. So I should have called and I didn't. And I ended up doing an extra month of nutrition classes and I didn't have to. So definitely call and find out your benefits. You want to call the benefits department, get the benefits for the bariatric surgery. And then you want to ask for the authorization department. You want to ask for pre-authorization or authorization department, typically what it's called. And you're going to say, they're going to ask for a case number, which you don't have one yet. You just want to say, I want to say what is the approval list to get approved for the bariatric surgery. And they should be able to provide that to you. They're going to tell you you have to do weigh-ins for X amount of months. Some programs, they say you have to lose X amount of weights before your surgery in the X amount of months of the weigh-ins. Some programs, if you have documented weight loss attempts from nutrition places, and I'll get into that later, you could actually just provide that documentation that you've tried already by yourself for X amount of months, and you don't even have to go through everything. So that's another thing. You know, they're gonna give you a list, and you should know going into it, because not all insurances are the same. Even though they have the same name, it's different. It's like a rabbit hole of all different benefits. So after the consultation, I met with my assigned nurse, who gave me a checklist of things to do. And I just wanted to die when I saw this list, because I was like, this is gonna take forever. So it was a long list. You see a lot of information. So they say there's certain things they'll check mark on there. It's my cat, sorry. There's certain things they'll check mark on there. So she wrote, supervised diet for 4 months. Please start this process ASAP. Again, with booking your consultation appointment, it took another, let's see here. I didn't get to meet with my dietitian until the 31st of May. So I called right after my doctor appointment on the 3rd, and I called our dietitian that we had to go through, and she wasn't available until the end of the month. So I was like, oh my God, I have to go a whole month before I can even start my first thing. That was the first thought, but then I started tackling other things as well. So call them immediately also, and your mental eval person, because you're gonna also have to do a mental evaluation too. Sometimes, depending, they might have you do a sleep apnea test as well, and that's something you want to call ahead, because if you wait to the last minute, like right before you think you're going to get approved for surgery, the sleep apnea test could say, oh no, this person does have sleep apnea, and then they want you to get a CPAP machine. So do not wait until the last minute, because you have to go through a DME company, a durable medical equipment company, and wait till you can even get the CPAP, and then you have to have a trial run at home for it to be set up, and yeah, don't wait at the last minute for these things, because then you just want boom, 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 all these things to be done, all these appointments, and then it's just month for your weigh-ins and nutrition classes, and then they say, hey, we're sending your stuff for approval. So don't wait. Also, they wanted me to do a gallbladder ultrasound, because I still have my gallbladder. They wanted me to do upper endoscopy and EGD. Also because me and the doctor are actually going back and forth. He suggested sleeve, and I said absolutely not to sleeve. I was thinking about bypass because I already had issues of acid reflux. Not bad where it was GERD, but I had issues with acid reflux, and doing this research by myself, I had seen a lot of patients that had done revision, and I had a personal friend, coworker, that had revision surgery as well, where she went from a sleeve to the gastric bypass because she couldn't even sleep laying down at night. She had to sleep laying up. So I did not want to go through that, and the thought of having 2 surgeries, I was already scared of one. I did not want to go through it. So that's what the EGD is for. They look inside of you. And then the nutrition classes with their recommended dietitian, and then the psychological clearance, and that was also recommended person as well we had to go through. And then after this full list of checklists, then they have, once you have a surgery date, then they have more things they want you to do. There's a pre-op class and a 4-hour class for that. Pre-admission testing, that's where they do more blood work, another physical, chest x-ray, EKG. And then they want you to fill your prescription for blood thinner. Not all programs do the blood thinner, which I found out through my Instagram and talking to other people in their program. So that was my list. So after I had scheduled the appointment for the eval, for my dietitian, even though it wasn't yet, they sent me a bunch of information and had pre-scheduled my 4 months for the, 4 months of the nutrition classes. So mine were spaced out. My consultation with the dietitian was the 31st of May, 2019. First weigh-in in class was June 15. Second one was June 18. Oh, no. So June 15, they did a 4-hour bariatric nutrition class. It was on a Saturday, and this was like an overview of all nutrition before and after surgery and vitamins, and it was a lot. So it was helpful. I have so many packets and things. So that was first. And then my actual first weigh-in that counted was June 18th, 2019, July 23rd, August 20th, and my last weigh-in was September 10th. So at that point on September 10th, I was like, yeah, I'm about to have surgery before the end of September. That was my time frame in my head. So keep that in mind, guys. So I did my initial consult with the dietitian on the 31st, finally approached and happened. In the meantime, I told you I called and made an appointment. I was going to make other appointments. So I had made an appointment for my EGD in the meantime, and that ended up being June 4th. So that was like really close after. I was so thankful. But the initial consult with the dietitian, it was an hour, and she went over everything, and it was really personalized, and she just talked about how weight loss even works and how it's effective and how it's not effective with diets, and it was really interesting. She has a lot of knowledge, so it's very knowledgeable. And then how much protein we're supposed to get in, and then we had a journal of like a mindful log, I think she called it, mindfulness log for food, to help us as well. And then she said to see you at the 4-hour class, plus the other classes, which were also a lot of information too. So the EGD consultation was, I don't know why I had to do an actual consult, but it was meeting with the surgeon, the person that was actually going to perform the EGD on me, the endoscopy. She just talked while I was there, and I told her I wanted to get the surgery, and then she looked at my numbers and she's like, yeah, the surgery will probably be very helpful for you. I was like, thanks. It will. So that, and then she scheduled me for my actual EGD, which ended up being 2 days later, June 6th. And that was pretty easy too. You go in there and it's like a 15-minute procedure, but I still had to call out for the whole day of work because it's my cat. That's Callie. She talks a lot. Anywho, so then for the EGD, I actually had to get put to sleep anesthesia, even though it was 15 minutes. That was the best sleep of my life. Stop. Don't do that. even though it was the best sleep of my life. Yeah, but I was groggy and I couldn't go back to work. But it's real simple, and that's where they actually put something down, like a little video camera down your throat and see what's going on in your belly. So yes, I did the EGD. I did my first set of blood work on Callie. Stop. Nothing's back there. No. My first set of blood work on June 12th for the doctor, and then June 18th was the first weigh-in nutrition class. And I actually weighed in there. It was 316 pounds was my first weigh-in. And then June 19th, I also had to do, and I forgot to mention off the list, I had to visit my primary care and get a medical necessity letter. So that's very important, and I was so stressed out about that because I hadn't seen my doctor in like almost 2 years. So I was like, man, are they even gonna give me the medical necessity letter because it's been 2 years since they've seen me? They had no issues. They honestly are so awesome. So I'm so thankful. And I now keep up with all my appointments with them. So yeah, so that was really easy. I just said I was there for a yearly physical, plus I need a medical necessity letter. I talked to the doctor and she was like, oh, what's going on? And I told her the weight, and I really had severe back issues at that time because of the weight, which prevented me from working out because it hurt so bad to even do activity 5 to 10 minutes. My back was in so much pain. So and she had no issues doing the medical necessity letter. So I had gotten that pretty quick. Sent that to the doctor's office. So that was check marked off. The EGD is now check marked off. Then my mental eval, that was another thing. I called in May to make an appointment, and she wasn't available, get this, until June 27th. So that was almost a whole month, like beginning of May, like almost 2 months. So the mental eval was actually scary too, because I was like, oh, what are they gonna ask me? I was asking all my coworkers, I went through this process, and they're like, oh, you'll be fine. But the thing is, I was already working on my mental health since the beginning of 2019. I actually started seeing a therapist December 2018. So every month, every week, I was actually seeing a therapist on Thursdays. So I really thought I would be good for the mental eval, but going into it, I mean, they ask you everything, all your questions. So like childhood, everything. So for me, I actually had a lot of like childhood trauma, childhood abuse. So, and that's what I was working on with my therapist. So after everything, she was like, she's like, I want to approve you, but she's like, I feel like you need to, that's what it was. I had stopped seeing my therapist. So I was seeing my therapist up until like the end of March, and then I had stopped seeing him. And then I decided to do the journey, blah, blah, blah. So at that point, she knew that I had decided that I wasn't seeing him anymore. So she was like, I recommend you start seeing him again, especially now and after surgery, your hormones will be all over the place and change. And she had recommended seeing a psychiatrist for actually Wellbutrin, because she's like, your lows won't be as low. And in addition with the therapy, I mean, you'll be set and you'll be ready. And I agreed with her, because at that point, therapy was helping me. So I was like, I don't know why I stopped. So I agreed with her, and I took her advice, and I made an appointment with my therapist, and then I started seeing him every Thursday, and I met up with the psychiatrist, which also was like another month before I saw her. My psychiatrist I didn't see until July 24th, 2019. So I'll get into that. So as a time frame, I'm going to go back to where I was. So mental eval, I did not pass. I had some assignments first before I passed, and that was June 27th. Now, from the EGD, July 1st, I actually got test results that I had gastritis from the EGD. So gastritis is like an inflammation in your stomach. Most people have it, don't even know they have it. At the time, I was drinking a lot of liquor, smoked cigarettes, wasn't eating good, so it was all of that. So I needed to get that cleared, which was a set of antibiotics. This was for like 2 weeks straight. It was pretty extreme. and then do another test to make sure the gastritis was cleared, which was really good because that's a stomach infection, and they didn't want me going into the surgery having a stomach infection because that just wouldn't be good. So I had to deal with that. That was like another milestone I wasn't really like expecting. One moment, I'm sorry. I apologize. I felt a sneeze coming, so yeah, so that was another milestone I wasn't expecting. Like during this journey, there's so many things that you have to do, and then they hit you with more news and you have to do. So it's like, just keep chugging through. But it can feel discouraging because it just feels like so much. But time will fly by. It does. So my gastritis ended up being cleared after I did the 2 weeks of the antibiotics, so that was all good. I was happy about that. At the meantime, I'm still doing my weigh-ins. My second weigh-in was on July 23rd with the nutrition class, and then finally July 24th, I got to meet with my psychiatrist, which is a super quick appointment. I thought it was going to be the same thing as like therapy, like you talk to them. They don't want to do any talking. It's just like, what's your symptoms, basically. And so yeah, the Wellbutrin was what I decided to try, and I had asked, and she was like, yeah, I agree as well. So I started on the Wellbutrin also, along with therapy. So my next mental re-evaluation was August 2nd, and I was like, it was like a brand new person at that point, because it just felt good to get yourself better again, mentally better again. And I was just crushing all my milestone goals as far as like what I had to do on my list. I'm already second weigh-in, you know, so I'm like, I'm halfway there. So yeah, so the second, July 23rd, the August 2nd, I had passed my mental eval. Ooh, I got approved, so I was really excited. That was a very happy day for me. So got approved for that. And then I got to chill all of August, which was nice, until the 20th, and that was my third weigh-in. And then August 20th, at that point I had got an email, because mind you, my last weigh-in's in September, the beginning. I got an email from my my surgeon's nurse, and she was like, hey, where's your gallbladder ultrasound? And I was honestly putting that off because I'm big and I like didn't want anybody to see my stomach. So I was like putting it off because I was like, oh, they're gonna have to be access to my belly. So I don't know why, it's stupid, but yeah, I was putting it off. So as soon as she had emailed me that day, I was already off for the mental eval. So right after that, I went and got, because I had the order already, I went and got the gallbladder ultrasound. Super easy. The lady was really, really nice. I don't know why I waited so long, so but I got it done. So that was all handed in. Finally, my last weigh-in was the 10th. Before that, they did me an appointment on the 6th of September was the last surgeon appointment, and that's basically where he went over everything I've done off the checklist, and then that's when we actually picked an appointment. So he saw my AGD. There also was some acid reflux, which I told him, but we did decide to do the gastric bypass, which is what I wanted to do and which I was going to do. If he didn't say that, I was probably still gonna search around maybe. So so we picked the appointment, real quick appointment, like 10 minutes, picked the surgery. Then the 10th was my last weigh-in. That was done. So immediately on the 10th, the next day, the nurse, she got all my stuff together. Well, she'd been keeping it together, but finally she submitted everything to the insurance, the authorization. And this, guys, is like where I had a hiccup. Again, mind you, so since I knew like how the procedure should be, it should be like a 2 to 3 day turnaround for authorization, because they know authorization is important because it's probably something major that you need done almost soon. So they approve it pretty quickly. So, you know, they give you like a week turnaround because, mind you, they're working like 50 other billion people's things as well. So that's what they tell you. So you also can call your insurance and find out the status of authorization. If you have anxiety, you're nervous, you're not sure what's going on, call yourself. Call the authorization. All you need to tell them is the surgeon's name and they bring up the authorization, and they can tell you if it's approved, if it's not, if it got denied, or if it's pending, and then you'll know. You don't have to wait for the nurse. So at that point, she said it got denied, and I was pissed because I had done all this work, you know, and she said it had gotten denied. So I had called the authorization department, and we went through all the paperwork, and basically the nurse had messed up. She had put my starting weight as my first doctor consultation weight, which is like, why would you even take that weight and put it in? Because you're supposed to, what's the point of weigh-ins? My first weigh-in, if you're going to use another weight that wasn't even my first weigh-in. So they were saying like, oh, you can't gain weight during the journey. So from that first weigh-in to the first the consultation to the first weigh-in, I guess I had lost and then gained weight. So then they were saying that's why I was denied. So it was like, no, that's not even the right date. So anyways, I had called the nurse and told her and explained to her what they said and how they need it to be submitted. And then she said, okay, and she would do that. So she actually forgot and didn't do it. So then I had called them again, and they said, no, nothing had been resubmitted, because that was like a Thursday or something. So then when I had called them again, it was like Monday. They were like, no, nothing had ever been resent again. I was like, what the fuck? So then I messaged her, blah, blah, blah. She's like, oh no, it's been submitted. Then she had resubmitted it at that point. So I called back, and they were like, yeah, now we got it. We're reviewing it. And so finally, so she resubmitted it on September 17th, and then I got approved September 19th. The best day of my life. So September 19th, I thought everything would be done at the beginning of September. So we're kind of pushing it, you know, only 2 more weeks left, and I wanted to have my surgery before the end of September. So she emailed me, said you got approved, and then she said the next available surgery time wasn't until October 17th. So I jumped on that. I said, yeah, that's mine, I want it. Yeah, so it was still pretty quick after, but it was still a month after that I had to wait. So a month after I finished everything, I had to wait, which was good, I think, for my nerves. So I got approved for 10/17 for my actual surgery date. On the 2nd of October is when I did all the recommended pre-op appointments, so pre-admission testing for the hospital. And that was the history and physical exam, lab work, chest x-ray, and EKG. And I had did that on the 2nd of October. And then there was a pre-op class scheduled. It was 4 hours pre-op class, and to sign our consent paperwork for the actual surgery, which is exciting. And that class just went over everything to expect during surgery, like right when they wheel you in, during, after, what to bring for surgery, and what to expect right after surgery, what kind of pain or if anything like that, what to do with any of your incisions, you know, all that kind of stuff. That's what that went over. And then that was it. And then I waited until 10/17 for my actual surgery date. So I might just insert a picture up, but I'm going to show you guys. So from, I don't know if you can even see it, from April 17th until 10/17 was the whole journey that it took. So from April 17th until 10/17, exactly 6 months. So I recommend start your journey now. Go to the seminar, do the consultation, do the nutrition classes, do it all, because you have that whole months of doing these things to decide whether or not you really want to do it. At the end of all the nutrition classes, if you don't want to do it, then you know, at that point you could change your mind. But just do all these steps and get it done with, because everyone always says, what's the one thing you regret or would change about the surgery? And it's always, I wish I did it sooner. And now I'm 4 months post-op. I wish I did it sooner, back in 2017 when I knew about it. So yeah, it's true. I wish I did it sooner. And it's a lot of work. So get it started, get your journey going. And I'm going to do more videos. I'm going to catch everyone up from my transition, from some of the classes. I'll probably do a group of that separate, and then maybe some helpful tips that I learned and what's worked for me. and then progress up until my 4 months and the different stages I went through. So I'll be posting more videos then. I hope you guys stay tuned and subscribe. Comment any questions. I'm on Instagram. That's probably how you found me, but if not, it's at bypassedwife, BYPASSED wife. Yeah, so I hope you guys talk to you later.